Hello, this is Usama. I'm studying MSc Data Science at University of Gloucestershire. Over the years, I have worked as a generative AI specialist and an AI product manager. I have worked with different product concepts using generative AI for solving problems. It could be to improve businesses or scale a business using AI and automation. So that's a bit of my background. I'm going to talk about my concept, which is basically to create a research driven product which contains a virtual doctor powered by GPT-4. GPT-4 is basically a large language model which has recently come out, a multi model which is not only relying on text but also images uh, and audio and videos and so on. It takes all of that input and it can give you output in different formats as well. So I want to utilize that GPT-4 to build a virtual doctor. I will talk about it uh, bit by bit. So as I said, the objective is to create a virtual doctor that utilizes GPT-4's capabilities. The vision is to enhance healthcare accessibility and efficiency by providing individuals with reliable and immediate medical insights and recommendations. Why do I want to do that? The reason is, despite all of these advancements in technology, the healthcare still suffers some of the problems. Which the big problems I categorize them into three: is long waiting times, and then there is limited availability of medical professionals, and then the fact that uh, there are cases of misdiagnosis and incorrect clinical decision making. So these are the three problems that drive the need for a virtual doctor. So it's more available and accessible for everyone. As I discussed before, how do we solve that? We use GPT-4's capability of integrating visual, auditory, and textual data to create a virtual doctor AI, which can comprehensively evaluate a person's health and enable accurate and immediate medical insights and recommendations. What would be our approach or should be our approach towards that? Initially, we need to collect some data and then perform some machine learning and deep learning techniques with human in the loop process. How it works is we collect data from various medical cases. The data could be text, image, videos, and audios, as discussed before. And then we use GPT-4's multimodal capabilities to process and analyze that data. And using all of that data, cleaning it, and going through all of that process using different models, we fine tune new models using GPT-4 as we and use an iterative process of training and evaluation. In training, we will feed the data to this model with labels, allowing it to learn patterns and correlation between symptoms, medical histories, and diagnosis. And meanwhile, we do that, the expert input would be incorporated. So it guides and validates a virtual doctor's decision making process. So we want human in the loop. It's like we are feeding it the data using all of the AI and all the techniques, and we want human in the loop that can evaluate the results. The human would probably experts in the field, which could be doctors, and so the general physicians. Evaluation. The most important part is evaluating our AI, since it's about a really sensitive topic. We want to benchmark it against human physicians to evaluate performance using comparative studies. We want to understand what a general physician has uh, done evaluation for a patient and what our AI did, and then perform some comparative studies, correlations between them. And based on that, we continuously improve our model as well. And once we have gone through the process, the expected outcome would be a digital product uh, which contains a virtual doctor that can provide reliable and immediate analysis and eradicate the problems that we have, like long waiting times, unavailability of medical individuals, and then there is this misdiagnosis and uh, clinical decision mistakes and everything. I feel the AI can really solve this problem, and it would be a major change because this is something that we really need. With all of the technological advancement, this is one area that people are not diving into. There have been limited research into it, and we need to explore this more and more. And it's really possible with the current technological advancement and GPT-4 coming in. So yep, that's all about my proposal. I would love to hear feedback. If people are interested, I would be more than willing to provide references for the claims and the methodologies. Over the years, I have worked as a generative AI specialist and AI product management. So if anyone wants to reach out and know more about it, I would be more than happy. Thank you so much.